Hi, it's Dr. Tucker, and today I want to discuss what are some common causes for headaches that are overlooked. And when you think of headache management, most people are just taking medications for it. So let's say they, have a headache, they take an Advil or maybe an ibuprofen and something else, and let's say that they're not responding to that. Some time goes by and they see a neurologist or their primary care doctor. Quite often they might end up on a prescription medication for it, Topamax or something else, where quite often they can have rebound headaches from the medication itself. So I want to show another perspective that I think is overlooked, and that is the structural issues that might lie internally. It could be obstructed blood flow, it could be obstructed nerve flow. But, this is the front of the neck, this is the back. We have a skull that sits here, and inside we have a brain, which controls and regulates every function in our body. So, everything that is dictated by an electric impulse, every cell, every tissue, every organ needs to have this good communication. It's our life force that goes from brain through spinal cord, right, down this big hole called the foramen magnum, and you're supposed to have good communication from tissue back to the brain. Now, what happens, there's this, as an example, first cervical vertebrae that actually moves different from the other vertebrae. It can actually go laterally and ride the skull, just like the Greek figure, the mythological figure Atlas, which held up the world. Well, C1, Atlas, the first vertebrae, holds up the skull and actually rides up this condyle. So if you have a structure sitting through here, your brainstem, right, with all your cranial nerves, you can have that vertebrae potentially shift from bad posture, from traumas, and create pressure as it moves laterally on blood vessels by creating distension, or compression on certain nerve roots by going laterally and jamming against it, or just creating a tug on the cord itself. So quite often as a chiropractor, we poke around and try to see if we find something poking laterally. And if under the ear here we feel one of those vertebrae kind of shift, especially something like C1, we might take some x-rays or take some other diagnostic test to confirm this, but then we know there's a physical issue that could be the root cause, and no Advil, no amount of Advil is going to fix that. That's where you want to come in by hand, and if it's shifted this way, start trying to get the alignment to move back so it sits in a neutral position and the structures don't get any compression on there. So if you're having a lot of headaches or even other funky neurological symptoms, it could be visual, it could be sinus-based, it could be tinnitus, definitely have your neck, particularly the upper cervical spine, assessed.